Okay. Hello everyone. Today we will study cardiovascular system. And at first we will study calcium channel blockers, CCB. And we divide CCB into two broadly categories. The first case, we call them selectivity CCB. And what's the meaning? We know we studied calcium channels in your physiological class. And calcium channel has 6 subtypes, such as L, N, T, P, Q, R. So what's the meaning selectivity CCB? That means selectivity block L-type calcium channels. For example, the prototypical agent is verapamil. Except this drug, and in this part, also includes amlodipine, nifedipine. They are selectivity calcium channel blockers. Compared to this one, the second type, we call them unselectivity CCB. That means just now we mentioned six subtypes calcium channel blockers. And each of them can block all these calcium channels. For example, the drug prelamine, they are unselectivity CCB. And in clinic, we also divide calcium channel blocker into 3 kinds. The first one, the oldest, the first generation CCB, verapamil, nifedipine. And this kind of drugs, they are short half-lives. So what's the meaning? That means our patients use nifedipine, for example, hypertension patients. They should use the drug each day 3 times, TID oral administration. And this year, we also have controlled release tablet. And this year, we also have the second generation calcium channel blockers, such as felodipine, nimodipine, nichindipine. Compared to the first generation CCB, the second generation CCB, felodipine, higher selectivity on blood vessel. So what's the meaning? That means we will use the second generation CCB mainly used to treat vessel disease, such as hypertension. And we also have the third generation CCB, such as amlodipine. And compared to the second generation CCB, the third generation CCB amlodipine, the longest half-life. The half-life nearly 35 to 48 hours. So what's the meaning? For example, our hypertension patients, if they use amlodipine, that means once daily, QD oral administration. So today we will study these drugs' pharmacological effects. At first, we know they are calcium channel blockers. So the first effects on heart. On heart, calcium be blocked. So the first pharmacological effects on heart, negative inotropic action. What's the meaning? Increase or decrease contractility? Decrease, very good. Will decrease contractility. So because we know calcium very important the role in excitation contraction coupling. And we inhibit the calcium channel. So calcium reduced and the myocardial contractility reduced, vasodilation, and then oxygen consumption reduced. So we have known in clinic, we have one kind of disease. The patients, suddenly oxygen consumption increase and suddenly very serious pain. We call this pain is the angina, yes, angina pectoris. So that means later we can use calcium channel blocker to treat angina pectoris, okay? And just now we mentioned the CCB, calcium channel blockers, 2 prototypical agents. One is verapamil, the other one is nifedipine. And the first pharmacological effect is negative inotropic action. And during these 2 agents, verapamil more powerful than nifedipine. So the question is, If later we will use CCB to treat angina pectoris, and in this urgence, two urgences, you will use which one to treat angina? Verapamil, excellent. Yes, we will use verapamil mainly used to treat angina pectoris. Negative inotropic action, and at the same time, calcium channel blocker also negative chronotropic action. Calcium B blockade. So we know calcium is a very important ion channel in action potential duration. So calcium B blockade, that means negative chronotropic action. Inhibit conduction, and then heart rate will be reduced. Heart rate will be reduced, so that means later we can use CCB to treat which kind of disease, such as hypertension, reduce heart rate, and tachycardia. Yes or no? Yeah. So later, because negative chronotropic action inhibit conduction, inhibit heart rate, so later we will use CCB to treat tachycardia. And these two prototype agents, verapamil and nifedipine. Verapamil, the effects of chronotropic action more powerful than nifedipine. So we use which drug to treat tachycardia? Verapamil, yes, excellent. The first effects on heart, calcium channel blockers, have negative inotropic action and negative chronotropic action. Except on heart, also effects on smooth muscle, calcium channel blockers, so dilation, smooth muscle relaxation. For example, vessel smooth muscle dilation, and we know on vessel more powerful on small artery than venous, so hugely reduce the peripheral resistance. Vessel dilation, blood pressure will be reduced, yes. So that means, we can use calcium channel blocker to treatment of hypertension, yes. So later we will use calcium channel blockers to treat hypertension as the first line antihypertensive drugs. And vessel dilation, CCB has these features. The first feature, higher sensitivity on spasmodic contraction blood vessel. In clinic, we have just now we mentioned this disease, angina pectoris. Most patients, we know the reason, their oxygen consumption increase. We call them stable form. And the second time, we don't know the reason. Why they suddenly pain? Because their coronary vessel suddenly spasm. So for this reason, calcium channel blockers, higher sensitivity on spasmodic contraction blood vessel. So that means later we can use CCB to treat this kind of variant anemia. Understand? Okay. And also higher sensitivity on coronary artery and cerebral vessels. We have two prototype agents. One is nifedipine, the other one is verapamil. So later we use drugs to treat hypertension, to treat variant anemia. And these two agents, now you will use which drug to treat hypertension, variant anemia? Verapamil or nifedipine? Very good, nifedipine. Yes, later we use nifedipine mainly used to treat hypertension, vessel disease. Except vessel smooth muscle dilation, also dilate other smooth muscles, such as bronchial smooth muscle dilation. So that means, we can use calcium channel blocker to treat which kind of disease? Asthma, yes. And also dilate gastrointestinal smooth muscle, uretary smooth muscle, and so on. Except these pharmacological effects, CCB, calcium channel blockers, also can inhibit atherosclerosis. Oh, that means yes, we can use CCB to treat cardiovascular system disease such as atherosclerosis, and can improve hemodynamics, inhibit platelet aggregation. What's the meaning? That means CCB can inhibit platelet aggregation, inhibit thrombosis disease. Yes or not? Yes. And except this, and can improve, protect renal function, have diuretics action. So very useful for renal function decrease patients. Just now we studied calcium channel blockers pharmacological effects, negative effects on heart, vessel smooth muscle dilation, and these effects. So let's study its clinical using. At first, we can use CCB, calcium channel blockers, to treat hypertension as the first-line antihypertensive drugs. We know in each country we have lots of hypertension patients. And we can use CCB alone to treat mild to moderate hypertension, or combination with other drugs, such as combination with beta receptor blockers, or combination with diuretics for mild, moderate, and serious hypertension. Calcium channel blocker, especially for coronary heart disease patients with hypertension. So now I have a question. If you have this coronary heart disease with hypertension patients, and in antihypertensive drugs, which kind of drugs, antihypertensive drugs, very useful? CCB, beta receptor blocker, diuretics, and so on. Which kind of drugs? CCB. Because just now we mentioned calcium channel blocker higher sensitivity on coronary vessel, and also used to treat cerebrovascular disease with hypertension patients. So now I have a question. If you use this drug to treat cerebrovascular disease, and which kind of generation CCB you will use? The first, second, and third generation? Second generation, because just now we also mentioned the second generation CCB, such as nimodipine, higher sensitivity on cerebrovascular disease, such as TIA, transient ischemic attack. And some patients, maybe they are arrhythmias, tachycardia patients with hypertension. So if we give them CCB, and in CCB we have two drugs. One is verapamil, the other one is nifedipine. So now for tachycardia patients with hypertension, you will use which one? Verapamil, because we know verapamil more powerful than nifedipine on heart, negative chronotropic action, and mainly reduce heart rate. The first using. The second clinical using of CCB used to treatment of angina pectoris. We know most patients, they are stable angina, but a few patients, we don't know the reason. Maybe the patients sit here or fall asleep, suddenly pain. We call them variant angina. And for variant angina pectoris, the first choice agent isn't nitroglycerin, and you should give them CCB as the first choice. In CCB, the best drug is nifedipine, because we know nifedipine higher sensitivity on vessel, especially higher sensitivity on spasmodic drug vessels. For stable, unstable angina, and we can use CCB, but your first choice agent is nitroglycerin. If you use co-administered with CCB, you should use verapamil. Okay. And the third clinical using, we will use CCB to treat arrhythmias. That's now we mentioned, especially for supraventricular tachycardia. Verapamil is the first choice agent for tachycardia, especially for supraventricular tachycardia, because negative chronotropic action. And except this disease, we also use calcium channel blocker to treat cerebrovascular disease. And here we know cerebrovascular disease, we should use which kind of generation CCBs? Second, yes. The second generation CCB, such as nimodipine. And these drugs can relax cerebrovascular and increase cerebral blood supply, and mainly used to treatment of TIA, transient ischemic tract, transient cerebral ischemia, cerebral embolism, and cerebral angiosperm. Other disease, for example, peripheral vascular disease. Do you remember you studied renal syndrome? And in alpha receptor blockers, phentolamine, but in fact, in clinic, we mainly use calcium channel blockers, vasodilation, peripheral vasodilation, and used to treat peripheral vasospasm disease. Also used to treatment of sclerosis, bronchial asthma, migraine. Do you know migraine? Yeah, headache. And this migraine, we mainly use the second generation CCB, nimodipine, to treat migraine. And 92% of patients use these drugs 4 to 6 weeks, will have good therapeutic effects, can treat of migraine, very useful. So later we will study the drugs idle fraction. And at first you should know calcium channel blocker, the major pharmacological effects on vasodilation, negative effects on heart, so the idle fraction. Most idle fraction are the consequence of the dilation of the arteries. So the patients, 4% of patients, they will tell you, doctors, I use the drugs, pastel headache, this headache, or dizziness, flushing, and edema of the extremities, limb extremities, edema. Except this idle fraction, because vasodilation, blood pressure decreased hugely. So the patients will tell you, about 1% of patients, they will have positive hypotension. And we call this the first phenomenon. What's the meaning? Only in the early stages, they use the drug, will have this idle fraction. Understand? Okay. And then, blood pressure reduced. We have studied in your physiological class, do you remember? Blood pressure reduced, and then sympathetic nervous activity increase. So reflectivity, heart rate increase. That means maybe we use calcium channel blockers to treat hypertension, but increase heart rate, oxygen consumption increase. So maybe it means induce angina pectoris. So for this reason, your stable angina pectoris patients, you should use, in CCB, you should use verapamil. Do you remember? Yes. And except this idle fraction, calcium channel blocker also induce cardiac depression because negative inotropic action and reduce contractility. So maybe induce heart failure patients, reduce heart failure. For this reason, serious heart failure patients should add the contraindications. And the negative chronotropic action for the patients maybe induce atrioventricular blockade or bradycardia. Today, we studied the basic agents used in treatment of cardiovascular system. Today we study the basic agents mainly used to treat cardiovascular system disease. We call them calcium channel blockers. Calcium channel blocker mainly inhibit the calcium channel and then negative effects on heart, vasodilation. So clinical using we use to treat hypertension, angina pectoris, tachycardia, and cerebrovascular disease. So you should know, at the same time, because negative inotropic action, because negative chronotropic action, also because vasodilation, so also induce the adverse reaction, the consequence of adverse reaction. Okay, today this class finish. 好，我们